Venturi Cardiology is an independent cardiology clinic that offers rapid, bespoke diagnostics in the area of cardiovascular medicine. So we are able to see patients and perform multiple different tests to analyse the heart muscle, to analyse the coronary arteries, to analyse the electrical activity of the heart, and to then sum all that up at the end with a consultation, so that people go away knowing the risk or having some reassurance about symptoms they may have had. So it is a one-stop shop for cardiology investigations. So family history is the main thing that concerns me sometimes, is that someone's had a mother, father, brother or sister who's had either a heart attack or a cardiac arrest or a stent or a bypass, or high cholesterol levels running in the family. So if that's the case, first of all, they would need a consultation. So we want people to come in, either have a consultation face to face now or do it virtually, so that we can get their history, get some ideas about what exactly symptoms they're having or worries or concerns they've got. And then if it's right for them, we can bring them here. And the patient journey is normally come in, have your ECG, have your simple blood tests, which can be sent away to a lab, or we can do finger stab blood tests here for cholesterol and for inflammation. And then move to the next room, have an echocardiogram to look at the structure and function of your heart, and to make sure your heart is normal anatomically. And then if you've got a family history of heart attack, we have the CT scanner, and the CT scanner particularly focuses on the heart arteries, so the coronary arteries, the arteries that supply blood to your heart muscle, and that's where a heart attack would originate. So we can see your arteries, we know whether they're furring up, and then with all that information we can put you into a risk calculator, and we can give you your bespoke risk for the next 10 years and advise you on what you should do with regard to your lifestyle and with regard to whether you need medication or not. So it allows you to get all the information together and to get an answer on the day, which is not something that routinely happens in the NHS. And that's why we came up with this concept, myself and Tom, because we think that because of the way the NHS is, it's a large super tanker with lots of patients, it's overspilling with weight. Even if we as doctors in the NHS put on extra clinics in the NHS, we'd still be waiting on the tests that we ordered for those patients, and those patients would still be waiting that time to get the answer from the diagnostics. With this clinic, we can get the answers from the diagnostics right away, which means we can act quicker, we can start prescribing drugs as required, we can start the lifestyle change. And therefore that's the beauty of this clinic. It could mean you get 3 months worth of NHS tests in 2 hours, for instance, so we're shortening the pathway right down. With heart health, the main concern is that you can run without symptoms for some time, and unfortunately for some people, their first symptom is death. And I know that sounds bleak and stark, but it's true. Some people may get chest pains, may get palpitations, might measure their blood pressure, their cholesterol, and realise that they might have an underlying issue. But what we offer here is the ability to look under the hood and to see what's going on inside your body, and then to either be reassured or to take action. Yep, so we work with GPs to inform the GP what we found here. Now, if something did need to happen, then we've obviously worked in the NHS in the Northwest for personally 20 years, so we have the contacts to be able to refer someone on further for more invasive tests, or if they required surgery, for instance, or special pacemakers, then we have the hotline to that end of the NHS, in particularly Liverpool Heart and Chest Hospital in Liverpool, and then in Manchester there's Wythenshawe and Manchester Royal Infirmary. So it depends on what the patient wants. One of the issues is plumbing someone back into an already overstretched system but you have to take a step back and say, well, if you hadn't come here initially and had the test done, you'd be even further back. So, you know, we will correspond with other cardiologists and surgeons on their behalf. The advice I would give somebody is not to put your head in the sand, not to put it off, and just, you know, accept that your fate may be that you die the same as your father at the age of, you know, 55 or 65. To actually take action and accept that you are going to need some form of investigation, because if you don't measure it, it's not going to get fixed. And you know, there are so many people who retrospectively, if we had just known where they were heading, we could have potentially aborted what turned out to be you know, a life-threatening situation. So my advice would be, don't put it off. Accept that there may be an issue within your family or within your lifestyle, or if you've got symptoms, reach out and come and see us.